Happy Innovation Month. February is the month that we celebrate innovation in UAE generally. And I always like to look at the Global Innovation Index. And in 2020, UAE ranked the 34th place globally and the first in the Arabic region.
We've seen how incredibly agile we have been in terms of responding to that pandemic. Within a few very short weeks, we were able to quickly pivot into telehealth, which is something very new.
I would like to ask, what are the current and potential challenges influencing digital transformation in healthcare from your point of view? Go ahead, please.
Thank you, Iman. I think if we just try to look at the healthcare ecosystem, there are plenty of solutions that started to be available. Involved are our clinical teams, doctors, nurses, clinical support teams, patient relations and patient ambassadors who really have the pulse and feel of the service. How can they be involved in designing this digital transformation and digital solutions?
Dr. Shweta, back to you. Can you please tell us, how did you set up the right digitalization plan from the beginning to ensure consistency and better clinical diagnostic outcomes?
That's a tough one. It's a nice question, Iman. You know, if you look at the digital technologies, they're seen as a gateway to solve many problems arising from the crisis. And of course, when you do the digital transformation, it is important that the internal and the external processes are consistent, and because that's the end goal of digitalization.
So we are trying to deliver the best and the first class and the highest standard of care to our patients in a very convenient way, easy to healthcare professionals, and in the most efficient and cost-efficient way.
Have an innovative digital solution to speed up the process and help the pharmacies is needed. And pharmacy technology and automation is one of the solutions for this problem. At UAE Medical and then at Emarat Hospital, we have implemented an automated solution.
Mobile applications and the web applications gave a greater and easier access to pharmacy services with a wider range of products with simplicity and convenience.
So at the IT level, I think we have for sure the technology of networking, integration, implementation, the ability to gather the requirements and translate it into technology.